Welcome to the Two Disabled Dudes podcast. We believe life is about how we react. All right, everybody, welcome back to the Two Disabled Dudes podcast. Sean, I want to check in. What has been going on with your one things for the past couple weeks?
Well, before I report on my amazing performance, I do want to tell you that finally, after probably at least 4 weeks, maybe 5, California is experiencing blue skies again.
Oh,
They're
yeah.
not perfect blue skies. You can still see a little haze, but it's finally not so yellow or brown all day long. And
Yeah.
that is exciting.
Yeah. It had to look like the end of the world sometimes.
Yeah. Some days like this is Armageddon right here. This is it. But beyond that, the one things have been actually really, really great. I've made improvements. So last week, one thing for me was cutting back on soda, and I threw in chips, and I went all week, technically my work week, no chips, and that's really where I have, every day is a salad and chips and a soda usually. Maybe not always a soda, but chips to go along with my salad.
Of course.
Something's got to make up for the salad, right? Yeah, I got to have something that's satisfying. But I went all work week, no soda, no chips. I took a long weekend to visit friends and some family in Portland. So I went into that trip not really holding myself to the expectation. And I went out one night. We went out for Mexican food. I enjoyed chips and salsa and a soda, but that was it. I didn't have any other chips or soda the rest of the weekend.
Wow, man.
So certainly some improvement on my part, and I'm feeling good.
Do you think it made you actually made your body function better, or did you feel any different?
Well, I can't say for sure.
Yeah.
I feel like mentally the answer would be yes.
Yeah.
Like I feel not as lethargic,
Right.
but I'm not sure yet that it's, I can tie it to
right
definitively because I cut out soda.
Right. Yeah.
But, overall I feel much, much better and proud of
for sure.
my performance, right?
Yeah. Well, that's like my report, a couple weeks ago, or maybe last week, I reported that I was slacking on my workouts, even though I committed to them. Well, I stepped it up the last 2 weeks, and I worked out, I think, at least 2 days. That was my original commitment, was 2 days during the week, and been getting on that. So it really made a difference to miss the mark, talk about it, and then be like, all right, what am I gonna do about it? So
yeah. And that's really what it's all about, right? What are you going to do about it? I think we all have to either come to terms. Either we give up on it and knowingly give up, admit to it, okay, we're done. Or pick up the pieces and figure it out. Maybe you have to go slower, or every now and then, or, maybe it's different than you want it to be. But it's never going to get better on its own.
Yep.
Like, you've got to start somewhere. So good job. I'm proud of you.
Thanks, man. You too.
Speaking of throwing it out there, a couple episodes ago, the idea was push-ups, right? Every day.
Yeah. Oh, yeah.
And I did them. I think. I don't remember. Actually, I may have missed one night or something.
Yeah.
But I've been doing push-ups every night for more than 3 weeks now.
Wow, nice.
Even when I was traveling, I did them in my hotel.
Yeah.
It's just help build the habit,
right,
that is important to me.
Yeah.
But anyway, enough about that. A while back, we got to meet Kevin Schnurr and chat with him over the phone. Kevin joined us via phones a couple months ago now, but we've stayed in touch, and he's getting ready to tune in any minute now to the episode, Kevin is the Director of Communications and Patient Engagement for the Alport Syndrome Foundation. And this was a conversation that I really enjoyed having for a couple of reasons. A, I don't know anything about Alport syndrome, or I didn't before this conversation. And we've heard about it through Riata, who we've talked a lot about on the podcast. We've heard about kidney diseases. Even in this conversation, Kevin educated me on what the kidney even does and how vital it is, right? So not only was he easy to chat with and fun to get to know, but it was really inspiring and insightful to hear what he has done despite his kidney failures, despite transplant, and what he's continuing to do for the Alport community. So here is our conversation with Kevin Schnurr of the Alport Syndrome Foundation. We are so excited to have you on the show today, Kevin. We've been looking forward to this conversation, mostly because I have no idea what Alport syndrome is. I think you're the first person I've met and talked to, even though I've heard a lot about it and I've heard the name a lot. I don't know much about it. So, Kevin, welcome to the show.
Hi, guys. Thanks for having me. It's funny you mentioned that because when I was first diagnosed, I didn't know a single thing about this disease either. And I find that that is often the case with many individuals that find themselves diagnosed with a rare disease. So I really appreciate the opportunity to talk a little bit more about my journey, about what Alport syndrome is, and to share how other patients can embrace their own diagnosis.
Yeah, I think that's understandably not an uncommon thing in the rare disease community, right? Like both Sean and I could probably say the same exact thing about Friedreich's ataxia. So we're all in the same boat here.
Yeah, I feel like, especially in rare disease, a diagnosis comes out and you're sitting there as the patient. What'd you say?
Yeah,
exactly.
I
have what?
Yeah.
Let's do that again, Doc. Kevin, that's probably a great place to start. Can you share a little bit about Alport syndrome? Or inform me and Kyle, and let our listeners know what it is, kind of what causes it, where does it come from? What is Alport syndrome?
Absolutely. I'm glad to have the opportunity to share this. When I was diagnosed with Alport syndrome and my kidney doctor told me about this in the hospital, I also went on Google. I was like, what is this? So now all these years later, I have lots more information to share. Alport syndrome is a rare genetic kidney disease. It's passed down in families from parents to their children, and sometimes it can even occur spontaneously. And that gets really tricky. It's hard enough to have a rare disease, let alone be the first one in your family to have it. And instances like that certainly make diagnosis very tricky. But those spontaneous mutations don't occur nearly as often. There are three major types of Alport syndrome. One we call X-linked Alport syndrome. The other type is called autosomal dominant, and there's also autosomal recessive. We also have some research that there is a fourth type of Alport syndrome as well. The big thing with Alport syndrome is that most individuals think of this as like a male disease, and that unfortunately is a misconception. The type of Alport syndrome I have is called X-linked, and as the name implies, it's carried on the X chromosome. So I received my mutated gene from my mother on the X chromosome, and this X-linked Alport syndrome that I have, I share with about 80 to 85% of other Alport patients. So it's really the most commonly studied type of Alport syndrome, the most common type of Alport syndrome you hear discussed in research papers and things of that nature. So with that said, my whole life, my mom knew that she had something called microhematuria. And what that is basically just blood that's seen under a microscope. And it's just something that the doctors wrote off as benign. And there is a condition that's called benign familial hematuria. And as the name implies, it's okay. So, my mom's doctors had told her growing up, it's fine. You have this thing. Your mother has it. Not a thing. So then I came along and I was the first male in a while. And it definitely was more than just a thing.
Yeah.
So, with that said, one thing that's really tricky in the Alport community is that because a majority of cases are passed along that X chromosome, women feel as if they are passing along the disease. And I like to use this analogy of like a hot potato. A lot of women feel that they're just carrying the disease. They refer to themselves as carriers, which is this terrible misnomer and terrible myth. They think they're kind of just passing along the hot potato, right? But the irony is you can get burned holding a hot potato. And a lot of women who identify as carriers, I'm using that in quotes here, incorrectly, themselves can experience symptoms, and they're led into this false belief that they are kind of immune, or they have, a magical superpower against this, and they're just passing this disease along. And we know that's not the case. So one of the biggest things is to make sure that women know that they can be at risk, and they need to be as monitored just as much as their male counterparts. For
Yeah,
me,
that's like Taylor Kane, right? We had her on a few episodes ago, and she told us all about how carriers can be affected in X-linked situations.
absolutely. And I was just going to say to you, gentlemen, Taylor literally made an organization for this exact cause, to spread the word that just because you think you're a carrier doesn't mean you can continue your life without being monitored and just, pretend that this is something that will only affect your children. And unfortunately, because that's been a myth for so long, so many doctors are still miseducated about this, not only with Alport syndrome, but other diseases. So we're always, every day, guys, I get emails in my role as the Director of Communications and Patient Engagement in Alport syndrome. Hey, I'm just a mom and I'm a carrier and I wanted to ask you about this. And right away, I'm like, wait, let's pincushion that. And I need to tell you, unfortunately, your assumptions are wrong. And in some cases, those assumptions, can be fatal. So it's really important to make sure that people are educated, about what the disease can actually do, regardless of your gender. And
So, Kevin, I'm curious what exactly or how exactly this impacts a patient. I would assume it's different for people, but can you share a little bit about your specific symptoms or the way it affects you? We know it's a kidney disease, but I think
right.
some people, besides, helping keep your insides clean, I don't even know what the kidney does, right? So can you
Sure,
break it
yeah.
down a little bit
Yeah,
for
absolutely.
us?
So let's talk about a few things. I guess let's start off with what the kidney does. I'm so glad you mentioned that. It's something that you might have learned in grade school and forgot. So
Sure.
the kidney's biggest job is to remove extra water from your body, to cleanse the blood, and to get those toxins out through your urine, which is great. The kidney also helps control blood pressure, which is super important. The kidneys are also responsible for producing red blood cells, and we love our red blood cells because they keep us nice and warm. And it's also responsible for forming an active form of vitamin D, as in David. And vitamin D is super important for bone health. So the kidneys do a lot. They really are a powerhouse of an organ. And most people just associate them with when you have to pee, right?
Sure.
So the thing with Alport syndrome is it's actually caused by a genetic mutation that affect the type 4 collagen family of proteins. And what type 4 collagen is, it's basically a major part of these tissue structures in our body that we call thin basement membranes. And they're present in the kidney, in the eyes, the ear, and even in other tissues in the body. So this collagen disorder is actually like the magical link between the kidneys, the ears, and the eyes, which are seemingly unrelated, but in Alport patients can all be affected. So with that said, going back to things that our patients experience, a large number of our renal patients do experience hearing loss. And the onset of that hearing loss can depend on a number of factors, and it can change. We have some children who have hearing loss at a younger age. Generally, not at birth. It's a little bit later. So with that said, their speech is normally not impaired. However, they have a few years of normal hearing, and then all of a sudden you're facing hearing loss, which can be equally as traumatic, to remember what it's like to hear, right? And then to start losing auditory function. So we have a lot of youth with hearing aids. We have a lot of individuals, particularly males, with that X-linked, the most common form of Alport syndrome. Generally speaking, their kidney function declines very rapidly in their late 20s. And for a lot of them, the hearing loss starts around that time as well. That was certainly the case with me. I had hearing loss, I remember, in college. I specifically remember an oral examination in an English class my junior year of college, and the professor read the 10 questions, and guys, I did not hear one of those 10 questions.
Wow.
And man, was it embarrassing, because I saw my classmates, they're writing down their answers, and I'm just sitting there like, shrugging, like, oh man, this is bad. And the worst part, guys, is I was too embarrassed to tell that professor I couldn't hear him. And
Yeah, I feel like we've all had nightmares that are exactly that situation, right? Like, yeah.
and Kyle, it's just like when you're diagnosed with a rare disease, that feeling of isolation and alone, and everyone else is in their bubble and you're in yours. And so having this kidney disease and then having the hearing loss aspect, it really is almost like a 1-2 punch. And some of our patients even experience vision abnormalities, which thankfully are often fixed with corrective lenses or with very minor surgery. So thankfully, that's not nearly as aggressive and devastating as the hearing loss and the loss of the kidney function.
Can you give us an idea of the prevalence of Alport syndrome?
In the United States, Alport syndrome is estimated to affect 1 in every 5 to 10,000 people. So with that said, that means approximately between 30,000 and 60,000 people in the United States are affected by this rare disease. The one thing that's tough with that is, as I mentioned earlier, with misdiagnosis or total lack of diagnosis, it's really hard to pin down exactly what that number is. But for a rare disease, there certainly are seemingly a lot of us. And it's my pleasure to bring us together and to interact with these patients daily.
Circling back, Kevin, to your experience in college, did you know at the time of that test when they listed the 10 questions, did you know you had Alport syndrome?
Well, no. So here's the thing. Only thing I knew that was maybe possibly different with me as a human being from my counterparts who had a clean bill of health was that I had at the microscopic level blood in my urine, and we call that microhematuria. And again, that was something that because my mom had and she was okay, my doctors always assumed that I would be okay with that. And truthfully, without me ever having had a kidney biopsy or any proper genetic testing done, there's no way anyone really would have known that I had Alport syndrome. So, I can't do the blame game too much. I know that I certainly had physicals and other types of lab work that should have indicated something was wrong. But I think a lot of those things were unfortunately just swept as the rug as maybe abnormal, but not really worth taking action on. In college, I was actually studying radio journalism, and I was doing work much like you gentlemen do, when I was going to loud concerts all the time. I'm a big music fan, and I figured, well, my dad has hearing loss, which happens to be completely unrelated to all this, but I said, my dad has hearing loss, I go to loud concerts all the time, and this is what I get, right? So there was never any reason to suspect that this was related to a rare disease. It wasn't until I was out of college. So I had this hearing loss, and I kind of just dealt with it by having people repeat themselves or saying, what? And some of my friends always joke that I was the guy who had terrible hearing. But in the summer of 2012, I had started a brand new job in graphic design. And one day I woke up and I had this ringing in my ears. And this is really the day that kind of changed my life forever. I went to work and I felt crummy. I thought I had an ear infection. And I said to myself, you know what? I'm going to wait till the end of the workday. I'm going to go to an urgent care clinic. Hopefully they'll give me something, for whether it's a sinus infection or an ear infection, what have you. And I was hoping to be on my way, right? And in the weeks leading up to that, I was feeling pretty crummy. I was really tired. I had lower back pain, which I know now is my kidneys, but I thought I was just exercising and not stretching properly. I was overly tired. I was getting nauseous. And I chalked this all up to just starting a new job and being stressed. I never in a million years would have equated it to having a rare disease. So that day that I planned on going to the urgent care, my boss came over to my desk in the morning. She said, Kevin, you don't look good. She's like, I really want you to just go to a doctor like now. And I was like, well, I'm glad you said that, because that was my plan at 5 o'clock today. So I literally left that office not knowing that would be my last day ever in that office. I went to an urgent care clinic, and the doctor took one look at me, and they took my blood pressure, and it was very high. It was so high that they took it 2 more times in 10-minute intervals after, just to make sure that there wasn't an error with the blood pressure cuff. And then they gave me a blood pressure pill and said, Kevin, you have really high blood pressure, and we're going to give you this blood pressure pill. If your blood pressure doesn't drop in the next half hour, you have to be hospitalized. And I was like, what? Like, this is crazy. What's going on? So needless to say, I take the blood pressure pill. It had no effect on me. And within the hour, I had to call my parents and say, could you guys drive me to the hospital? They want to put me in an ambulance, but I don't have insurance. So how about you guys, mom and dad, drive me to the hospital? I get to the hospital, and very quickly, the blood work indicated that my kidneys were failing. That was very evident right off the bat. And as someone who didn't have any change in their urine output, I said, what do you mean my kidneys are failing? I pee all the time, every day, just like everybody else. Like, what do you mean? And they're like, yeah, but Kevin, you're not peeing out your toxins. Like, there's literally just toxins are accumulating in your bloodstream, and like your feeling of nausea. And I literally had this like metallic taste in my mouth. It's actually a buildup of urea in your body. Again, when you find all this information, it kind of hits you like a ton of bricks. All these things start to make sense. Like, oh, wow, okay, this ring in my ear, which came out of nowhere, sometimes can be attributed to the high blood pressure. It can also be attributed to the hearing loss. That pain in my back, my lower back, those are my kidneys that were like, Kevin, what are you doing, buddy? Get to the hospital. I had terrible leg cramps at night. And again, I attributed that to exercise. We know now that was a terrible electrolyte imbalance because the kidneys were failing. Everything started to make sense.
I feel like it's a another common thing in the rare disease community, right? We have all these signs that we just have no idea. I grabbed onto one thing you said. Your friends were saying that you can't hear very well. Well, my friends were always saying that I was the clumsy one, and that was true too. But we didn't know. Obviously, that was due to FA. I think it's a common thing where we justify all these things until it comes down to that point where it's like, all right, something's really up here.
And for me, I often think about this. Had I known I had Alport syndrome at a younger age, there are current treatment guidelines that the Alport Syndrome Foundation does recommend for not only our pediatric patients, but for our adult patients. And those treatment guidelines are essentially blood pressure lowering pills. We have pills we call ACE inhibitors and ARBs, and they're very common blood pressure pills. They help reduce that pressure on the kidneys, and you basically want to keep your kidneys happy. And the longer you can control your blood pressure and keep your kidneys happy, the longer you can stave off time until you start dialysis. So, had I known about my diagnosis sooner, we probably could have bought me a few more years, so to speak. But there I was in the hospital, completely crashed and burned. And they said to me, Kevin, we have to start dialysis today. And in my head, I was like, whoa. Because in my head, I just kind of equated dialysis as like a thing that older people have. And I know now that that's a terrible misconception that I have, that there are so many youth on dialysis. And I was like, wow, dialysis, like this is like serious. And my next question was like, okay, I'll do this. And then like my kidney function is going to bounce back, right? Like I'll be out of here by Monday morning, right? And, they let me know like, no, your kidneys are completely failed. I had something like 11% kidney function, which is terrible. Absolutely terrible. Most people even start dialysis at a much higher percentage of kidney function than that. So there I was. I had to have emergency surgery because it was a Friday night and there was not a full staff of surgeons and technicians at the hospital. We had to do a groin catheter, which is, as the name implies, not a fun place to have a catheter. Definitely one of the most painful experiences I've ever had in my life. And it really was kind of like a duct tape fix until the next week when we can do proper dialysis surgery for me, which they ended up doing the next week.
So if we were to fast forward quite a bit, you've had a kidney transplant, right?
That's correct. So I ultimately ended up doing 2 years of home peritoneal dialysis. And during those 2 years, I was attached to a machine, and it basically was connected with a tube that connected to a catheter in my abdomen, and it would fill up the lining of my peritoneum, which is basically just like your abdominal wall cavity. And it would fill up with this dialysis solution, and it would slowly drain it out and fill it up with solution and drain it out. And it was kind of like a magnet and took all the toxins out. But I was attached to that machine for 10 hours every night for 7 days a week, which is a long time. And it certainly was a tremendous burden on not only my structuring my daily life, but my mental health as well. And then in May of 2014, my best buddy was gracious enough to give me the gift of life in the form of a living donor kidney transplant. And, he saved my life. And
Yeah,
Wow.
that's huge.
Wow, what's
Uh,
that connection like between you and your buddy? That must be pretty neat.
yeah, it's funny. He and I have been best friends for many years. We worked in retail together, and it was a very stressful job. And it was just one of those great friendships that kind of formed from being in the trenches together, so to speak. Dealing with stressful situations in retail, and we became best friends. Even after both leaving that job, and we really were just like brothers before this. So when he told me he wanted to be my donor, I believed him. I knew he was crazy enough to do it. The question was, would he be able to pass all those tests, and would all the blood work and everything work out? And with each progressive step, as things kept being green light after green light after green light, it really was wild that at the end of the day, ultimately a stranger that I met, working a job would
Right.
go on to save my life. And,
That's pretty
the
amazing.
irony of that's not lost on me that, it's really something.
I think it would be a good thing to talk about before we wrap up our time together, specifically organ donation.
Absolutely.
I know when you and I talked on the phone a little bit before this interview, that was an important factor to your health and well-being, and I know that's probably true for millions of people in America and even across the globe. So, can you talk to us about maybe the value or your perception of how organ donation works and the value it carries in the world today?
Yeah, sure, Sean. I think the first thing that people need to understand is there are so many people that are awaiting a life-saving transplant right now. And we're not just talking about kidneys, we're talking about hearts and lungs and livers and other type of organs and tissues. And as of this morning, there's over 110,000 people on that national waiting list. And to put into perspective for our Alport community and the larger kidney community, actually not over, it's close to 93,000. It's about 92,800. So let's call it 93,000 out of those 110,000 need a kidney.
Mm.
So that list is basically almost entirely kidney patients that are waiting for that life-saving transplant. And as I mentioned with my personal experience, being on dialysis attached to a machine for 10 hours a day is so debilitating. And that's peritoneal dialysis. There's also hemodialysis, which many folks are probably more familiar with, and that's the type in which you go to a dialysis clinic 3 times a week for about 3 to 4 hours. They stick you with a needle, and you're attached to the machine. And certainly that type of schedule can be equally as frustrating and debilitating as far as trying to work while on dialysis. And if you
Right.
have kids at home, dialysis very much uproots your regular form of life, and you obviously have to do this. You either, continue treatment, or there's really no or. I mean, I know some
Yeah.
folks who choose to not do dialysis later on in life, and they are certainly entitled to that choice. But it is kind of a, do this treatment or accept your fate scenario, and it's really, really hard for patients. So with that said, organ donation is so critical because for me, I was able to first and foremost feel a lot better. When you have kidney disease, you're anemic because you don't have enough red blood cells. I was cold all the time. Guys, it would be the middle of the summer, that July, and I was wearing like 2 sweaters. My friends were like,
Wow.
thank God you have an excuse with the kidney disease because that's weird. And, you're so fatigued with kidney disease, you're tired all the time. I was taking
Mhm.
more naps than a normal college student does. I mean, it was nap time all the time because you were just so exhausted. So when you get that kidney transplant, you have that energy again. You have the good red blood cell count, so you're warm and you're energetic, and you can return to work full time without those restrictions from all the time you would spend doing dialysis. And again, the mental health thing is so big. It's just almost like the pie in the sky, white light in the darkness is that transplant, like getting that. And don't get me wrong, there are complications that can
Right.
accompany transplant, and some of the medications have side effects. But ultimately, for the best quality of life and the longest longevity as a human being, that transplant really is the goal. So the one thing that gets frustrating is we know based on studies that over 90% of people in the United States support organ donation. They think it's a great idea, but only about 60% are registered as donors. So
Mm.
there's a big disparity there between people think it's cool and people who actually sign up to do it.
Yeah.
So it's really important to share the personal stories, like my story, and how much Matt, my best friend's decision to be an organ donor, completely changed my life, like a total 180 for the better.
Right.
Not only that, but every day that we're not acting to help those people on the list, every 10 minutes, a person is added to the US waiting list. So the list is only getting bigger and bigger. And we know, I've seen numbers that say between 17 and 20 people can pass away a day while waiting on that list. And certainly some of the hearts and the lungs, those fatalities certainly can happen at a higher frequency than the kidney patients. But still, it's so important that, it's a simple act. The way I see it, um, when I'm no longer on this earth, everyone can take my body, do whatever they
Sure.
want. They can take my body for science.
I want to ask you before we move on from that, what's
Sure.
the there's this thought process that if I tell the DMV that I want to donate my stuff,
Hmm.
that if I were in a car accident and they see that little sticker on my license, that maybe they won't be so apt to care for me. They'll just be like, oh,
Right.
well, let's give them to that cause instead of prolonging life. What do you have to say about that?
Sean, that is absolutely one of, if not the number one misconception. That is absolutely not the case. It would be unethical to do that. And so many people believe that the doctors won't try as hard if, they see that you have that little heart on your driver's license. And we know that's absolutely not the case. There are so many other misconceptions. And, there are plenty of great resources online at organdonor.gov is a great resource. Companies such as Donate Life, and they'll list all these myths, and that's exactly what they are, as myths. And the organ donation process has gotten easier. You can certainly let your DMV know. If you have an iPhone, you can simply go into your health app. They are officially paired with Donate Life, and where you type in your health app, your medications, there's a little area that says, would you like to be an organ donor? And within 3 or 4 clicks, you could potentially save not only one person's life, but we know that up to 8 people can benefit from one single organ donor, not to mention the dozens of people that can benefit from your cornea's donation, from your skin tissue donation. There's just so many people that can benefit from one donor. And to me, I think that's, I always say you can outlive yourself. And that is one way to do that, is just to sign up as an organ donor.
That's a great takeaway for our listeners from this episode, right? Like, all right, if there's a couple things you're going to remember from this episode, everybody sign up to be an organ donor through your health
Absolutely.
app, or it's not that hard.
Yeah, and
Yeah.
if you're worried about the whole license CHP not helping you or whatever, do it on your Apple, your app,
Yeah.
or set it up with your family or something, so that when the end of life comes, you're
That's
able
very,
to
I'm glad you
live
said that,
beyond
Sean.
that. Yeah.
That's very important. We're aware of many situations where families don't have something like that in place. And if someone is in, say, a vegetative state or something like that, and the family doesn't know what to do, and they don't know the wishes of the person that is ill, it's important to communicate with your family. Yeah, exactly. At the very least, do that.
Well, Kevin, I feel like we could probably talk for hours, but that wouldn't be fair to our listeners too. And man, what an incredible conversation. Eye-opening for sure. And I know we're just scratching the surface of even Alport syndrome. We have just a little bit, but then a whole dialogue on whether it's supporting organizations like Donate Life or just simply being a part of the process beyond your own life and just helping carry on a legacy for a lot of other people. I think
Sure.
one thing we will be sure to do is link to a couple organizations where folks can consider donation of their organs. We'll make that easy for our listeners to check out. The other thing, I want our listeners to be sure to have easy access to. Kevin, tell us where people find the Alport Syndrome Foundation, or where they can get connected to what you guys are doing.
Yeah, absolutely. So for us, the biggest resource for our patient community is our website, which is alportsyndrome.org. And we're thrilled to offer not only treatment guidelines, which are super important, we have information on ongoing clinical trials for our patient community. A couple of years ago, we had no clinical trials, and now we're fortunate enough to have 2. We also have a thriving private support group on Facebook, which is moderated by Alport Syndrome Foundation staff. And it's a great way for patients who contact us right away to immediately hop into the conversation pretty much at any hour of the day, because we have patients from all over the world chatting. So I'm always thrilled to be able to connect patients like that. I think it's so important for people to realize I suffered in silence way too long, and I completely understand the need to grieve. And there is certainly an acceptance process that everyone has to go through at their own pace. And I just want people to know that you can take your time to, internalize your disease and to accept your disease, and then just don't suffer in silence after that. Then immediately reach out, find the support group. For me, it was finding Alport Syndrome Foundation. For other rare diseases, there are respective support groups. But just get out there and do that. Find another patient. There is nothing more powerful than meeting another patient with a rare disease, especially the one that you share, and being inspired by them and being reassured by them and just having this positive impact on your life.
Kevin, we're so incredibly grateful that you took time out of your day to get on the phone with us, to share a bit of your story, and to help encourage our listeners to consider organ donation. And not only that, but to spread a little bit of awareness for the Alport Syndrome Foundation. So thank you for your time.
Thank you guys for having me.
Thanks, Kevin.
Stay well.
Man, what a great conversation. I think one of the things that all of us, it's sort of required, or it makes us better if we learn as much as we can about our own disease, so we can know how it's going to treat our body and how we can fight back, right? And I think that people like Kevin are helping other people learn as much as they can, right? Because he's just an absolute wealth of knowledge about Alport syndrome. I love it.
Yeah, and I would assume, just given his job, right, he's kind of gone all in and committed to helping everybody else, or a lot of other people, process the journey. So I agree. He is definitely paying off that he's paid attention and he's helping educate.
You paid attention in biology class.
Yeah. Anyway, with that, thanks, Kevin, for joining us and being a part of the Two Disabled Dudes podcast. Kyle, I want to hear what you're going to do this week. What is your one thing for episode 120?
So, episode 121, next week, we're going to be talking about the Radiotaxia Global Challenge. And it actually starts on Friday, so a few days before the episode comes out. So on Saturday, the 26th of September, I am gonna ride a century with a few friends on the bike trail, 100 miles in a day, and looking forward to it. We're gonna start probably around 7, and I bet we'll finish like 4 p.m. or something like that. It'll be a long day, but it's gonna be great.
Sure. Do you have your route planned out?
Yeah, and we actually did it earlier this year in July. We did a century of the same route. It's probably 90% on bike trails. So so it's a nice, safe, easy ride,
Sure. How big is your group?
I think we have 3, maybe 4 people.
Okay.
So
cool.
Yeah.
Well, my one thing for the week will pale in comparison to yours. As I mentioned early on, we got blue skies again. So I'm going to go back to one of my initial one things was ride 25 miles during my work week, right? Get home at 6 p.m. and go for a bike ride. It is starting to get dark a little bit earlier, but I think there are a few nights that I can get out and put in 8 or 10 miles. So my commitment this week is to ride another 25 miles during my work week.
Nice. All right, man. We'll be checking in on that one. I guess we should jump into our thank yous, right?
Yeah, let's wrap it up.
Yeah. So today I want to thank, I've just been thinking about it the last couple weeks, and I'm really
Did that
grateful.
hurt?
What's that?
Does that hurt?
Thinking about things.
Yeah.
I fight through
It's
the
a dad
pain.
joke.
Okay. But you and I both know how much effort it takes to participate in a clinical trial. And, these trials are the way that drugs move forward. There's no other way, right?
Sure.
And so I'm just really grateful for everyone in the FA community. And shoot, it's really in the news right now, right? Because of COVID-19 and vaccines. So just clinical trial participants, I just have a lot of gratitude for.
Awesome. I like it.
What about you?
I would add for mine, last week, some of our listeners might know, we got to help out with the Global Genes Rare Patient Advocacy Unsummit. And we got to moderate a watch party of where we showed 4 different short movies of rare disease stories. And I had a blast. That was so much fun. It was really cool connecting with other people in the community, engaging, having conversations with some of these film makers and subjects, and just kind of hearing different stories, different diseases, and growing a bit in my own experience within the rare disease world. So I'm grateful for Global Genes for inviting us back and allowing us to be a part of their Unsummit events again. So I'm grateful for that. Thank you, Global Genes.
Yep, great films and great people, good conversations. It was a lot of fun.
Again, Kyle, another fun episode. Thanks for being here and agreeing to listen to me ramble for a minute and vice versa. Thank you to our listeners for tuning in. We look forward to sharing another episode with you next week. Until then, keep living with urgency.
Thank you for listening to the Two Disabled Dudes podcast.
Find us online at twodisableddudes.com and subscribe on your favorite podcast app. Connect with us on Facebook, Twitter, and Instagram.
Special thanks to our friend and audio producer, Jake Tompkins.